My name is Dr. Robert Carolla. I am a physician, graduate of Ohio State Medical School of Medicine, and I have practiced for many years as a medical oncologist. I treated a variety of patients with malignancy. After my retirement, I had noticed that I was having some urinary tract problems, having to get up frequently in the middle of the night. And sometimes I would have some leakage, which was very disturbing. I met with my personal urologist, and we tried a variety of medications, which did very little. In fact, my symptoms got worse. And I finally came to him and said, "You've got to do something. I can't live this way." So he said, "Let's biopsy your prostate." And lo and behold, I had prostate cancer, and this was quite a shock. Here for many people, I treated patients with cancer, and then suddenly I, as a cancer specialist, developed cancer. The options for treatment of cancer are several. I chose to have radical surgery, total removal of the prostate. And in this procedure, the actual name of the procedure is a radical prostatectomy and lymph node dissection with nerve preservation. The nerve preservation is very important because if the nerves are preserved, then after the prostate is gone, hopefully you will be able to be continent and be able to control your urinary stream and also have return of normal sexual function. So I had this surgery. It went very smoothly. It was done laparoscopically, and I recovered very fast and was doing quite well. The pathology report was excellent. All the cancer was removed, and I was feeling that I had beaten the cancer. And I still feel that way, but the problem is after the surgery, the incontinence became worse. And so, again, a variety of medications were tried without success. And the surgeon told me that I needed to do these Kegel exercises, which is strengthening the muscles of the pelvic floor. These are important. Even though the nerve is preserved, you have to still have the muscle function. The nerve has to stimulate the muscle. And the muscle is weak after surgery. Now, let's face it, below the waist, the anatomy of women and men is totally different. However, we both have pelvic floor muscles, and these muscles must be toned and strengthened in order to maintain continence. So the Kegel exercises were prescribed, or where you bear down and contract the pelvic muscles and try to hold it for anywhere from 3 to 30 seconds and then relax. And then repeat this for a series which is called a set. And you are supposed to do several sets every day. I tell you, I did all this for several weeks and came to the conclusion that I was getting nowhere. So I was watching TV and I saw a commercial where a woman was talking about the EMSELLA treatment. And I thought, would that work for me? So I studied it and found out exactly what it does, which is strengthen the muscles of the pelvic floor. And men and women are similar here. We both have pelvic floor muscles. And women often have weakness because of childbirth and damage to the muscles. So I thought this certainly could work for me, but all the advertising that I saw was for women. So I called Brenda here, and she researched it and said, no, it can be done for men. And then I did do my own research and found out that yes, it does work for men. I think it is a procedure that is not well known in the medical community that's available. The EMSELLA treatment sends electromagnetic waves to the pelvic floor and contracts the muscles. It does in a matter of 30 minutes what weeks of Kegel exercise cannot do. And so I came here to New Radiance and had one treatment, and I thought, gee, I'm better. After 2 treatments, I've had no further problems. So I have continued the series of treatments. The response has been fantastic. I believe that this is a curative procedure for my incontinence. Now I fully realize that muscles have to be stimulated in order to remain toned and function normally. So it's entirely possible that in the future that these muscles will grow weak, and I will probably try some Kegel exercises, but I know what the result is going to be, and I'll be back here for more treatments. I can tell you the EMSELLA experience is painless. You sit on the machine in a relaxed state. I watch TV, specifically Seinfeld reruns, had a great time, and was looking forward to each and every appointment. I can't say enough good things about the procedure. If you have incontinence, I would urge you to investigate the EMSELLA experience. It really works, and I couldn't be more pleased.